This year, there have been two major studies that have been published. The first study that was published, I think it was in March, April, this was by a collection of universities, including Harvard as well as Cambridge University. And what they did was basically a meta-analysis. Now, there have been several meta-analyses over the last few years. And in this meta-analysis, it's pretty much confirming what was found before. In this meta-analysis, they looked at data from many, many studies with a total of some 300,000 subjects. Those 300,000 subjects, they looked at their dietary fat intake, they looked at fatty acids in the blood, and they also looked at supplement fatty acids that they were taking. You know, a lot of people take, for example, fish oil fatty acids as supplements. So what they found was very interesting. When they looked at dietary fatty acids, and this is in many studies, some 250,000, I don't know the exact number, but very large number of patients, what they found was that saturated fat intake really did not correlate with cardiovascular disease risk. So it had no impact. Neither did monounsaturated fat. And polyunsaturated fat we always think is supposed to be beneficial, and even that was showing only a weak association. So fatty acids in general, saturated fat, no relationship. And now for many years we've been telling people to replace saturated fat with polyunsaturated fat. And what these authors concluded from their analysis that recommendation actually needs to be reassessed. By telling people to replace saturated fat with polyunsaturated fat may not be producing the benefits that we think. And we spend a lot of time, effort, resources in trying to educate people or teaching them how to replace saturates with polyunsaturates. And if you're not getting a clear benefit, then maybe it's time to move on and look at other things. Maybe our public health message should be towards something else rather than this phobia on saturated fat. So this data is sort of consistent with what's been coming out over the last 3-4 years, namely that saturated fat doesn't appear to be the devil that we thought it was. And a lot of the studies over the last 3-4 years have basically shown that it may not be doing anything. Now in this analysis, they also looked at fatty acids in the blood and how they related to heart disease risk. And amongst the saturated fatty acid, they found a very weak association for palmitic and stearic acid, which are saturated fatty acids. But this they didn't say was because of those fatty acids coming from the diet. It's actually these fatty acids are made by the body in response to a lot of carbohydrate intake. So if you're taking a lot of calories, that gets converted to fat. And so the fact that you have elevations in these particular fatty acids could simply reflect increased carbohydrate intake, excess calories, which then get converted to these fatty acids, and you find these in the plasma. So that is also sort of in line with what we've been saying, what the data has been saying over the last few years, that it seems to be carbohydrate that is the major driver for effects on CHD as opposed to saturated fat. So this is this meta-analysis. Now, a couple of months later, I think around April, May, there was another meta-analysis published, and that was specifically on palm oil. And so in this meta-analysis, which came from a group in Italy, what they did was they looked at numerous studies over the years in which palm oil has been fed. And there were some 1,500 subjects in this meta-analysis, 40, 50 studies across many different countries. And in these studies, diets were fed for anything from 2 weeks all the way to 16 weeks, and the level of fat in the diet, went from some 20% of calories all the way up to 40, 50% of calories. So, a large number of studies, and what they looked at was specifically what does palm oil do? What does it do in relation to something like stearic acid, in relation to, let's say, lauric and myristic acid, in relation to trans fat? And what they found was, they found both adverse and beneficial effects. So let's explain that a little bit. When we talk about cardiovascular disease risk, we talk about LDL cholesterol and HDL cholesterol. LDL is the bad cholesterol. If you have a lot of it, that increases risk for CHD. If you have a lot of HDL, the good cholesterol, that's beneficial. So in this meta-analysis, there seemed to be increases in LDL cholesterol with palm oil relative to certain dietary manipulations. But there was also increases in HDL cholesterol. So you're sort of getting positive and negative effects. Now, One way to reconcile all this is to measure something called the total cholesterol to HDL cholesterol ratio. And this is what clinicians use as an indicator or assessment of CHD risk. And a total cholesterol to HDL cholesterol ratio of less than 4 is considered desirable. What they found when they looked at the ratio of total cholesterol to HDL cholesterol was that palm oil had the same effect as any of these other manipulations. So relative to stearic acid, the total cholesterol to HDL cholesterol ratio was not impacted by palm oil. Relative to monounsaturated fatty acids, it wasn't impacted. Relative to polyunsaturated fatty acids. So relative to most of the fats typical in the diet, the ones we want to utilize, the unsaturated, palm oil was as good. A clear-cut difference was palm oil relative to trans fat. Palm oil was definitely better than trans fat in that if you replace trans fat with palm oil, the ratio of total cholesterol to HDL cholesterol decreased. So this meta-analysis is consistent with the data that's out there. There are several studies that have shown when you compare palm oil directly with some of the unsaturated oils, that there's no real effect on blood lipids. So this meta-analysis, it's coming out of Italy. It's a group that is looking at a whole bunch of studies, and they're essentially finding that there was no effect of palm oil on the total cholesterol to HDL cholesterol ratio. So that's good. So the saturated fat story, basically we're at the point where carbohydrate seems to be more important. That's what we need to focus on, and especially the refined carbohydrates you have to watch out for. They seem to have more detrimental effects than saturated fat themselves. And then as far as palm oil is concerned, this meta-analysis now is simply a sort of summation of all the studies that are in the literature, and it's essentially saying that, palm oil's effect on blood cholesterol is not something that we need to worry about.